Welcome to another episode of the Cannabis Review. I'm delighted to be joined today by Clifton Fack. He's the co-founder of SciTech Cannabis. How are you keeping today, Clifton? You well?
I'm doing good. How are you doing?
I'm excellent. Thank you very much. Thank you very much for coming on the show and helping share a little bit of wisdom for the audience that are watching. I'd like to maybe, if you want to start, I think the first topic is going to basically bring the start of your career in the industry into it. So we'll just start off. Can you give us a start guidance on how you got into cannabis and your relation to Israeli cannabis?
Sure. So first of all, thank you for having me on. Very exciting. And good things moving forward in Ireland. So my background, I'm born and brought up in England. Actually moved to Israel about 15 years ago. My professional background is marketing and entrepreneurship. I found myself involved in cannabis. It was about 6 years ago now, as the medical cannabis was kind of beginning to explode in Israel. And what we saw back then was, I think we're going to talk about it soon, but one of the things we saw back then was a big lack of entrepreneurs. Not enough companies, not enough young people with innovative ideas or business plans or technologies to drive the industry forward. And still back then, there was very much it was a taboo. The entrepreneurs that we would meet many times hadn't told their family and friends what they were doing because there was still this stigma around cannabis. So what we did was, we began by launching an event called Canatech, and the idea of Canatech was to bring together entrepreneurs and investors and try and create discussion around the industry. So my first couple of years was really based around that, kind of building ecosystems and raising awareness and some government lobbying to try and move everything forward. Then about 4 years ago, I came to a painful conclusion that the medical cannabis side of things, or the THC, or the doctor-prescribed cannabis, however you want to call it, is fraught with so many obstacles, so many problems. Whilst they can and are being overcome, in the short term, it's consumers that are missing out, whether it be regulatory or entrepreneurs or product availability. So I moved from the THC side of things to the CBD side because in 2016, the UK began to recognize, or the MHRA recognized that CBD has medicinal benefits. And then from there, the awareness and the education of what CBD is and what it can do just began to blossom. And that's why I set the business up. So SciTech was formed 4 years ago. The idea is to bring medical cannabis quality products to the CBD market. And that's what we did. We launched Provocan, and Provocan's our flagship brand. We launched that 4 years ago. We're now one of the market leaders in the UK. And it's exactly that. There's no cannabis leaf. There's no green coloring. It looks like it's something the doctor would prescribe and your pharmacist would dispense. And in short, it's something that as a consumer, that when you look at the product, feel it and use it, that it immediately elicits trust that it's going to work, and trust in the company. That's a little bit about how I came to where we are today.
Okay, excellent. And could you give a little bit of a background on your products are developed in Israel with the leading scientists that they've got over there. Can you explain to the audience how long Israel have been in the research and development part of the cannabis industry and why they're considered the world leaders at this?
Sure. Well, I think we've been in the research and science side since day one. Actually, Professor Raphael Mechoulam, who's often referred to as the grandfather of cannabis medicine. It was him in the late 1950s that began to research cannabis, and he and his team throughout the 60s discovered and isolated THC. They coined the phrase the entourage effect, and a whole plethora of other cannabinoids were discovered by them, and they began to research and really uncover the medicinal benefits of the plant. Because up until that point, all we knew about the plant was it gets you high and it's illegal. And on top of that was built the propaganda of everything that we've known in the last 40, 50 years. So really, it was in the 60s that we began to kind of break through those molds. But it wasn't really until about the late 1990s, so California was already beginning to move towards medical cannabis. And we'd reached a point where we were not just researching from the scientific side, but we kind of moved that investigatory intuition into the medical, into the clinical study world of things. So by the late 1990s, we were already beginning to research and understand and uncover what it can do, everything from epilepsy to autism, PTSD. There's a number of indications that wouldn't have been known about had it not been for hospitals and indeed patients over here in Israel. And we've continued that path. So we do have this amazing perception, and it is true. There's more clinical studies here for cannabis that's going on in this country than all of the world combined. There's hundreds of studies going on right now, everything from preclinicals in little petri dishes through to full-on human studies, double-blind placebos. Almost every hospital in the country has some kind of cannabis clinical study going on. And to the point that even in the last 2 or 3 years, the stigma of cannabis has all but disappeared. The final stretch will be when we actually legalize in government, and we hope that's going to happen in the next year or 2 or 18 months. But certainly, it's very rare now that you would find anyone that would speak out against cannabis, because almost everybody knows someone who's benefited from it. So we're in a good position over here.
Yeah, no, and I think that leads me perfectly onto the next topic, which I hope we're going to start to see more of, which is encouraging more startups. What do you see being the hinder block here? Is it the actual fact that it's still illegal and a lot of people frown upon it, and the floodgates of entrepreneurs creating startups will happen once there's that kind of full open legalization? Do you see that happening?
Unfortunately, yes. I mean, there is some innovation, there is some entrepreneurs going on. There has been for a number of years, but certainly it's the regulatory, the doors that are closed, because THC is psychoactive, and in almost every country it's still illegal. It's still a controlled substance. So yeah, from everything from just gaining a license to research the product, let alone use data or any kind of innovative technology where you need to touch the plant to develop it, it becomes a problem. Now we've all thought, we all hoped that just the medical cannabis regulations that have been rolling out would open up the market enough to allow entrepreneurs in. Unfortunately, that hasn't been the case, and I mean, I believe that's mostly down to until the financial institutions can involve themselves in the industry, then everything gets blocked. Entrepreneurs need investors, and investors, while investment is growing significantly, it still lags way behind other industries at this stage in their growth. By now, we should be looking at, there should be VC funds and family offices and all manner of investment coming in. In the UK, I mean, even I think this week, there's 2 companies that are listing on the stock market in the UK this week. It's fantastic news. 2 or 3 years behind where it should be. But we're hoping now that, now that's happening, the floodgates will open, and over the next year, there will be a lot more investment coming in, which is going to encourage startups. There's nothing more disparaging, and I know this for myself, nothing more disparaging for an entrepreneur than knowing that there's nowhere to raise money from. Banks aren't giving loans because it's still illegal. So really, yes, this is what we need to do. A free market's required to develop the industry. We know that exciting products come from creative minds, and this is what we need. So we need to push this through, and it's coming. It's coming slowly, but it's coming.
Yeah, no, I agree totally with you. What do you think of the headlines of the sale of GW Pharma there recently? Is that a good thing for the industry or a bad thing?
Well, look, it can only be a good thing. Any time that cannabis is normalized, and I use this word a lot, that the sooner we can normalize cannabis, the sooner that all normal things will happen, including entrepreneurs and good products and good regulation. We need that to happen. And as I say, I think it's happening now.
Yeah, no, I agree with you as well. Kind of leads me on to the last thing I wanted to talk to you about. You're a man who knows how to build a brand between the stuff you've got with James Haskell and the various other products that you've got out. What are the 3 tips that you'd give to somebody who's starting in the cannabis industry on how to build their brand up?
3 tips. I'll give you 1 tip, because I think it all starts with one thing, and that's trust. How you then, dismantle and deconstruct the word trust. But, so my background is marketing. I'm not a science or a medical professional. And so I come at the industry from that marketing and brand building side. And I know from my years in the industry, in other industries, but in brand building, you've got one target. Your bullseye that you target every single time is to build trust. Because, when you've got consumers who are choosing between different brands, what's the one thing that makes them decide one over the other? It's which one they trust is going to work better, that they trust is going to be more, that the branding, the brand language is affiliated to them. They trust that when they tell other people about it, that they're going to get a good reception. It's trust, trust, trust. And that in the CBD or cannabis industry is not an easy task. We're talking about fundamentally healthcare products, something that people are using either as either in replacement of regular medicines or alongside regular medicines. This is not something that's for fun. So to build trust in something that people are using for their health is not easy. What we did, I guess this is my single biggest takeaway, is we identified where the trust is. Right or wrong, the trust is in medical cannabis over CBD. Certainly, if you look at the markets in America and actually over here in Israel, there is a perception in the marketplace, and again, it's wrong, but it's how it's evolved, that if you want efficacy from cannabis, then you need medical cannabis, you need THC, and that CBD doesn't do a good enough job. Now we know that's not right, because arguably it's the other way around. CBD is the anti-inflammatory, CBD is the anti-anxiety, CBD does so many good things. THC does some good things, but from a therapeutic perspective, it really is the CBD. So what we did is, we had to ask ourselves, how do we bring the credibility of medical cannabis into a CBD product, into a wellness product? Because again, medical cannabis, you'll see it's being sold, a specific strain is good for autism, or a strain is good for cancer. There's very close indication-specific strains, which without the clinical studies, it's not a legal position to take. And certainly in the CBD world, we do not make claims. We sell it as a food supplement. There's no doctors, so we cannot say that our CBD is good for PTSD, or that this one is good for pain. All we can say is our CBD is good. So to build that trust is quite complex. What we did is, from day one, alongside the development of the products that we do over here in Israel, we began investing in and working with a lot of universities and hospitals on clinical studies. So we've involved ourselves, and we funded a number of them, but we've involved ourselves in cannabis studies to look at potential to treat asthma, the potential to treat fatty liver disease, diabetes. We've partnered with the Medical Cannabis Nurses Association in Israel to share knowledge, because we've got tens of thousands of customers who feed back what they use it for, how they use it. Now, we can't use that for marketing because that'll be a claim, but we can feed that back to the nurses that we work with, and they feed us information. We can kind of work with our customers. So it's a kind of a symbiotic relationship. So if you look at our company, SciTech, the background is we're positioned as a biotech or an R&D company that just happens to produce good quality CBD products, as opposed to what we see in the marketplace, which is companies that begin as a CBD brand with not much behind them, and then move on to try and establish trust and establish credibility. We took it that's first and foremost. First and foremost, you can have an ugly brand, you can have a very ugly logo, you can do all those things wrong, but as long as the essence behind the brand is strong, then in the healthcare world, that's going to work, because people will forgive a bad tasting product. People will forgive a badly packaged product if it works, if they can sleep, if their pain is gone, if their anxiety is gone. They'll forgive all these things as long as they trust it works. So that's what we did. We built trust based on involving ourselves in the science and the medicine. And it's also a very interesting side of the industry. It's very exciting.
Okay, yeah, that's a great little note to finish on. Trust out there, everybody, for a acceptable business. That's the fundamental pillar that you need to put in place. Actually, as you were speaking, I could think of a ton of CBD companies that are literally now trying to pivot in to make every pharmaceutical thing and become lab testers and all this kind of stuff. Whereas, yeah, as you said, if you get all those pillars in the place in the right place at the first time is where the aim should be. Clifton, thank you very much for coming on the show. It's very much appreciated. I wish you all the best for this year, and hope we get you on again maybe after this novel food license deadline to get your thoughts on that over in the UK.
Absolutely. Thank you very much. Look forward to it. Have a good day.
Have a good day, guys.